The World Health Organization estimates that air pollution is responsible for more than 7 million premature deaths every year around the world, contributing to heart disease, lung cancer, and respiratory infections.
When we breathe in dirty air, which we call, the air pollution, there are some small particles, we call them particulate matter, which are so small that when you breathe in, they quickly go into the lungs and continue to the bloodstream. Those eventually, if you are exposed for a long time, then you develop lung disease, asthma, and eventually other cardiovascular diseases of the heart, stroke, they set in.
Kampala is ranked among the worst air polluted cities in the world, with its air pollution ranging between 5 to 7 times above the recommended World Health Organization air quality. This, according to Professor Lina Tuyambe from Makerere University School of Public Health, is not only dangerous to human health but poses a great danger to pregnant mothers and increases the risk of preterm birth rates.
As a university and as a School of Public Health, we have been doing research for the last, 8 years on air pollution. Since 2015, 16. And so we have been monitoring the air pollution. And at the moment, I can safely tell you that we are not safe. The air we have in Kampala is 3 times the recommended World Health Organization standards.
When you are exposed to a lot of pollution, and that if you could give an example of carbon dioxide, it affects the body system. That is one. 2, if the air is full of carbon dioxide, it brings in some kind of dizziness. You have heard of people that are asthmatic, including even pollens. Particulate matter, when it comes into the respiratory system, the breathing becomes a challenge. You have seen it with very many people who are asthmatic.
Kampala is the home to more than 2 million people, with an estimated 50,000 cars making their way to Kampala city daily. The rural-urban migration has partly contributed to their huge numbers, with pull and push factors contributing to the problem.
So if you look at the population of vehicles that enter the city, if you look at the population of motorcycles, very old motorcycles that even do smoke, that are not maintained, all those produce a lot of pollution in the environment. If you look at the population themselves, people themselves produce a lot of carbon dioxide in the environment, especially if there are no trees or any other way of dealing with the pollutants.
Kampala Capital City Authority has embarked on 3 action plans, which include the Kampala Climate Change Action Strategy, Air Quality Governance Framework, and Clean Air Action Plan. Alex Nyabachira is Kampala Capital City Authority Coordinator for Air Quality Program.
To coordinate the efforts of air pollution control and improve air quality for the city, we put together a document. First of all, we have 3 main documents: the Climate Change Action Strategy for the city, the Air Quality Governance Framework, that mainly states that it is a multi-sector issue, and then the third is the Clean Air Action Plan. The Clean Air Action Plan is the main document we are implementing, because it states how these other 2 should be implemented.
It will cost the country billions of shillings to purchase air quality monitoring kits and dispatch them countrywide. Airco, an institution based in Makerere University, is using a low-cost devices to monitor the air quality in different parts of the country. Preliminary results collected in the past few months indicating the Central Business District has a hotspot for air pollution, and this occurs during morning and evening hours.
The pattern means that in the morning there's an increase due to human activities. Now during lunch hours we have seen that the value reduces a bit down, and then it starts increasing again in the evening, 6 up to like 9, and then starts reducing again. So within a day we have 2 peaks in Kampala. And then a year we have also 2 peaks during most time during the dry season.
Sada Mubale, UBC News, Kampala.